Good morning, everyone. We're going to get started. It's so good to see so many faces here this morning. Thank you so much for coming. We are here this morning, and I am here personally hoping to represent the millions of families across the state and country who benefit from the Medicaid services that they currently receive. So right off the bat, I'd like to thank Senator Casey and his wonderful staff, Mayor Kinney, and my colleague, Sean Aliong from the ARC of Philadelphia, and Talia Gottesman, and anyone else that has helped make this possible today. But most of all, I'm inspired by all the faces that I see here today who've taken time out of their busy lives to be present and to be seen and to be heard and send the message that we're not going to stand by and allow others to make decisions that are, as Senator Casey says, a matter of life and death. And this is true for millions of Philadelphians, Pennsylvanians, and people across this country. And we're talking about Medicaid. And you've heard the talking points and the statistics on TV and lots of talking and numbers and how many people this is going to impact. But each of those statistics is a real person, like you and like me, with their own unique life. But today, I hope that we can show that if we stand together in our right to advocate for what's fair, and not only what's just fair, but for, in our particular circumstances, for life itself. Learning how to advocate is something I've learned to do over the course of the past 11 years. My name is Lisa Wallace Larkin, and while I'm here today representing the ARC of Philadelphia, I'm going to take this time to talk more about my role as a mother. I'm an inclusion facilitator currently with the ARC of Philadelphia, something that was inspired by my son, who I'll talk a little bit more in a minute. I'm a former special education teacher who had a total life change with the birth of my son, and more specifically when he became school age. It's such an honor for me to be here, and what I'm hoping to do is for you not just to see me, one person, standing up here telling you my story. What I'm hoping is, whether you're here because you're a parent of a child with a disability or you're someone with a disability yourself, that you can find a little bit something about what I'm going to talk about today that you can connect with. And whether you're not in any particular category, maybe these devastating cuts that they're proposing won't impact you at all. But what I'm hoping to get the message across today is that we need each other, because this is about so much more than health services. So when my family gets the supports that we need, we can participate in life. We have lots of friends who can see, including like people who are close to us, who are a part of our family and our life, but still, no one really knows the challenges that we face on a daily basis. It's full of wonderful gifts, but every day, we look for every opportunity to create the life that we want. Though many people don't realize it, Medicaid helps both poor and middle-class families, covering nearly 1 million children in Pennsylvania. Nearly 2/3 of children who receive Medicaid live in a home with at least one adult who's working full-time. Medical assistance is often the only insurance that will cover behavioral therapies. I'm going to take a minute here, and I'm going to introduce my family. That's my son, Aaron, back there. On the shoulders of my husband of almost 20 years, John Larkin, and thank you. And my 14-year-old daughter, Lillian, who's thrilled that I'm about to point her out over there. She's trying to hide. They are you, and you are us. Or we are in this together. I want to put a face on the numbers and the statistics. Thank you. So, my son was diagnosed with an intellectual disability and autism at the age of 4. This was done at DuPont and was possible through our medical assistance coverage. These evaluations that end up setting the course for the types of services that my son will need cost $3,000, $5,000, $6,000. So even if you have private insurance, that medical assistance and Medicaid is the difference between my son getting the services he needs and not getting the services he needs. I cannot emphasize that enough. We had early intervention services that helped come in. When he started school, schools receive funding through these sources to provide the services that children with disabilities need. We know that the behavioral interventions that many of these children receive work. This is a lifelong condition, and with the proper services and support, my son will grow up to lead, and hopefully my daughter, a productive and fulfilling life, which is what we all want. But the best outcomes are achieved when children with disabilities receive these services from a young age. These therapies during childhood mean that people can avoid needing intensive, ongoing care as adults. So we need to stop being reactive. We need to be proactive and keep the funding in place now so that we're not paying for it 5, 10, 15, 20 years down the road. So I could sit up here and talk about what makes my family unique, and I can focus on disability, but instead I'm going to focus on what all families have in common for the most part. We all struggle to get maybe dinner on the table, to get the grocery shopping done, to get our children to after-school events. If you have a child with unique needs, I have a son that has no sense, that the world is a dangerous place. So how am I going to cook dinner, help my daughter with her homework, and not keep him from opening up a window and falling out of our Philadelphia 3-story row home? Medicaid also provides the benefit of in-home services through the waiver program, home health aides if your child has medical needs. We are not asking for anything above and beyond. We are asking to keep these funds in place to help even the playing field. We just want to do what all families do, but if we don't have those kind of services, we tend to exclude ourselves because it's harder to go out. With this funding, it helps our communities to be more inclusive. And we know that inclusion benefits all of us. So when life gets hectic and we're trying just to survive, the services we receive through medical assistance are like a life vest for us, right? All families, we're all always trying to keep our noses above water, right? I mean, that's a common thing we all share. That Medicaid, that funding is our life vest. It literally, with the in-home services that we receive, the ability for my son to get the dental services he needs to maintain dental care, that keeps my nose right above the water, and I'm right there along with all you. It's more than just about the medical. This is life insurance for us. The thing that I've learned over the course of the past 11 years is that we have to advocate and fight for everything. For my son to receive a free and appropriate public education in the least restrictive environment. Schools are helped with the funding they receive from Medicaid to help make that so. This is about long-term outcomes. This is about making an investment now in our children and our families so we can have a better future for everyone. So as we move forward and we send the message that this is not okay, this is about life. These are real people. Let's focus on what we have in common. Let's focus on the shared desires and try and create solutions that all sides can see. I'm grateful for the opportunity today to be seen and to be heard. So I hope that you'll continue to advocate, because it's hard and it's exhausting. And it's not fun and nobody wants to do it, and we'd much rather be doing a lot of other things. But we must be vigilant for our children, for our neighbors, for our fellow Philadelphians, Pennsylvanians, and Americans. I thank you for this opportunity. Don't give up. No matter what. So I am giddy and humbled and thrilled to have the honor to introduce our United States Senator Bob Casey. Senator Robert P. Casey, Jr. is Pennsylvania's senior senator. He works every day on behalf of Pennsylvania families, fighting to create jobs, advocating for the education and well-being of children, and pursuing a national security strategy that protects our interests and supports those who serve our country. He serves on 5 committees, including the Senate Finance Committee and Senate Help Committee. Senator Casey and his wife Therese have 4 daughters and live in Scranton. And on a personal note, I just want to say how grateful I am for Senator Casey and all of the work. He is a huge friend of the disability community, which makes him a huge friend of us all. Thank you.
Well, thanks very much. Lisa, thank you for getting us started, and thanks for bringing your own personal story to this issue. This is about as big a challenge as we've faced in a long time as a people. No matter where you live in the United States of America, this is a challenge that we have to confront, and this bill is a bill that we have to confront and defeat in the next couple of weeks. So, I want to thank Lisa, and I know that Sean will be coming after me, and Talia, and I especially appreciate the presence of Mayor Kenney. Let's give him a hand for being here with us, for his exemplary public service, hosting us here, but in a very special way, for being the Jim Kenney that I've known for more than 30 years. Someone who fights for the little guy and the little guy and girl, who fights for the vulnerable. And in this fight on health care, we're especially grateful for his leadership, for his passion, and for his dedication. So thank him again. Look, this is a complicated subject, right? But the debate is rather simple. Let's start with the fundamentals. This bill that Republicans have put before the United States Senate is not really a health care bill. It's a scheme to give away a lot of money to rich people. That's what this is. That's all it is. I'll get to Medicaid in a moment, but if you don't think this bill is about giving money to rich people and corporations and special interests at the expense of Medicaid and the people who depend upon Medicaid, you probably haven't read the bill, because of the 140 or so pages, more than 60 pages deal with Medicaid. So they're coming for it. They're gunning for it. And we have to stop them from doing that. So here's what it is. This bill in large measure is just that. It's a scheme to give away hundreds of billions of dollars to the wealthiest while selling out the middle class and while hurting seniors and kids and people with disabilities. And you know what? We will not stop fighting till we stop this bill. Now, there's a lot of reasons to say that, but the fundamental reason is it's wrong. It's wrong to rip away Medicaid coverage to 15 million people. 15 million people. The House bill, which I was told was the more conservative bill, right? Some guy in Washington called the House bill mean. I can't remember his name, but he called it mean. Well, if the House bill was mean, that cut 14 million from Medicaid, what do you call a Senate bill that cuts 15 million from Medicaid? Fill in the blank with whatever words you want. But this bill in the Senate is worse than that very bad House bill. We got to stop it. Let me give you a sense of what I'm talking about when it comes to Medicaid. The decimation of Medicaid, lots of ways to describe this. One word is abomination. It's an insult to who we are as a people. We're Americans. We take care of people. We don't send them off on their own when they need our help. And you know what? As much as they try to divide us on health care, we are coming together. You know where I was the last couple of days? I was in small rural counties in Pennsylvania, especially in northeastern Pennsylvania. And you know what I saw there? I saw a lot of the same adverse impact to those families and to those communities as right here in Philly. Look, we know this, and there are lots of numbers flying around, but just consider this, what this bill did for Pennsylvanians. Hundreds of thousands across the state got health care, right? Through the Medicaid expansion or through the marketplace, the exchanges. All those families benefiting across Pennsylvania. In fact, in Philly, by one estimate, more than 223,000 people got health care because of the Affordable Care Act. But you know what? You know what they're trying to do now? They're trying to rip away that health care for tens of thousands of those very same people that live in Philadelphia. And you know what? When you go across the state, I was in 5 rural counties just the last couple of days. If you added the population up of those 5 counties, it would be a fraction of the city of Philadelphia. But you know what? The cuts there are as bad or maybe even worse. Susquehanna County, by one estimate, 2,190 people would lose their coverage after they gained almost 4,000 people with coverage. Bradford County, over 2,900 people losing coverage. Sullivan County, a tiny little county, 330 people, we estimate, would lose coverage. Columbia County, 2,900 plus. Wayne County, 2,700 plus. You know what that adds up to? In 5 small population rural counties, just 5 out of the 48 rural counties in the state, 5 small counties would lose more than 11,100 people in those counties would lose their coverage. Now, why would anyone vote for that kind of a bill? Why would anyone vote for a bill that cuts health care for seniors, cuts health care for people with disabilities, cuts health care for people across the board. Why would anyone vote for that? Well, you know why? Because some of them really believe that their job in Washington is to make sure that almost every bill is about a giveaway to the rich. So here's the numbers, folks. Here's one of the numbers that you should bear in mind. According to an analysis of the House bill, you may have seen this chart. When they analyzed the House bill, which I said may be even a little tiny bit better than the Senate bill on Medicaid, here's what the House bill told us. The 400 richest families in the country would share $33 billion. I said 400. I didn't say 400,000 families. 400 families would receive a tax cut of $33 billion. Maybe in the Senate bill it's only $30 billion. Maybe they're really cutting back on those families that are having trouble making ends meet. This is, when you compare what they're trying to do to Medicaid and what they're giving away to the rich, this is obscene. That's all you can say about it. It's obscene, and we have to stop it. So, I've gone on long enough. I just want to say in conclusion, thank you for standing up. Not only for your own families, not only for your relatives and people that you work with or in whose communities you live. I want to thank you for what you're doing for your country, because no domestic issue right now is more important to us than stopping this bad bill. And we don't have months to do this. We are down to days and maybe a few weeks, maybe just 2 weeks, maybe 3. But I'm assuming it's going to be just days and weeks. And we need you to stay in the fight to stop this from happening. Because there are very powerful special interests that really want those tax cuts for the super rich, for corporations, and for other special interests. So it's us against them. And you know what? I'm confident that we're going to win this fight. God bless you and thank you.
The next person to speak is Philadelphia Mayor James Kenney. In his first year of office as mayor, he worked closely with City Council to fund bold anti-poverty initiatives, including expansion of quality pre-K, inclusive pre-K, the creation of 25 community schools, and $300 million investment in parks, rec centers, and libraries. In his second year, he continues to work towards the successful implementation of these programs while taking major steps toward addressing the opioid epidemic and other public health issues in Philadelphia. Please welcome Mayor Kenney.
Good morning, everyone, and thanks for being here. It's not a pleasurable thing we're talking about, but it's a pleasure to be in front of you talking about it. I also want to say I am so proud that we have at least one senator that has a heart and cares about people. And I always tell them it's because of the Jesuits. I have the same issue. The Jesuits got us a long time ago and turned us into people who care about people or are sensitive to people's needs. I've said this before and I'll say it again. As mayor, it is my duty to do all I can for the well-being of Philadelphia residents. As a human being, it is my obligation to speak out against injustice when I see it. The injustice that is Trump care will be utterly devastating to the people of Philadelphia. Currently, 26% of Philadelphians live at or below the poverty line. This is more than any other large city in the United States, and we're working very hard to change it every day. While we have made a lot of progress in this regard, we still have a very long way to go. Altering a program that 650,000 Philadelphians rely on for their health coverage will not only halt this forward motion, it will cause us to regress. With the AHCA's cuts to Medicaid, our city's most vulnerable citizens, such as children, Those suffering from addiction and dependency and those with pre-existing conditions will be harmed. 3 out of 4 children in Philadelphia depend on Medicaid for their health care. When children don't have access to health care, it greatly affects their ability to learn. Many of the individuals who suffer from addiction and dependency need Medicaid in order to access the vital treatment and supportive housing that keeps them off the street and away from this temptation. Pre-existing conditions like multiple sclerosis often make health insurance unaffordable for those who suffer from issues like this. And when left untreated, it can make their mobility nearly impossible. By denying these individuals medical care, their fates will be sealed, making it impossible for them to reach their full potential or even to stay alive. If you cannot find in your heart to think about the people these cuts will affect, then I will leave you with a major fiscal implication. Aside from the countless healthcare jobs that will be lost in our city, Trump Care calls for the elimination of the federal financial commitment to the most vulnerable that has existed for the past 50 years. This burden will now fall on the states and will create a massive hole in Pennsylvania's already ridiculously budget. I mean, we got criticized a couple weeks ago for successfully coming to a contract with our teachers and scolded by, and we were scolded by people who are leading the state into a $3 billion borrowing in order to pay for operating budgets. So I'm wondering who's criticizing who here. But if you voted for Donald Trump, and I don't think anybody in this room probably did, but if you voted for Donald Trump and you voted for him because he was going to repeal Obamacare, and you have a parent or grandparent in a nursing home, you better order that hospital bed now because they're coming home, and you're going to have to take care of those folks in your home. If you have a child that has an intellectual disability or a physical disability, you're going to have to spend more time on your own dealing with those issues because you're not going to have any help anymore. And you may have to even quit your job to stay home with your child because there's no place else for your child to go during the day. If you live in a rural part of Pennsylvania and you have one hospital and your child gets sick or you get sick, you better gas up the car because you've got to drive to Philadelphia or Pittsburgh in order to get health care because those small community hospitals will close. This is just stupid stuff, and it's mean stuff, and they know it's mean. The president has said it's mean, but he's still pursuing it anyway. And these are folks, and our senator is a stalwart and a stand-up person, and I'm not talking about him. But if they really want to be less than hypocrites, then they should drop all their health care because they get... Their health care is not Cadillac, it's Bentley. So, yeah, well, a lot of things, I agree. Senator Casey's right, we have some time to do this. We don't have a lot of time to do this, but we need to stick to it until it's over. I sense that there are senators in Washington who are in the Republican Party that are really afraid about voting for this thing because they're afraid they're going to get booted out of office, and they should if they do. And I think we'll be successful in the end. But don't if we are successful, and hopefully we will be, don't ever think they're going to stop. Don't ever think that what Trump represents is an oligarchical type of government that is run by his family and benefits his family. It's almost a mob mentality, and that's not going to stop until 2018 when we take back the Senate and the House, and in 2020. 2018 when we take back the Senate and the House, in 2020 when we deport Donald Trump. Thank you.
Thank you, Mayor Kenny. Sean Aliong is a board member and colleague of mine at the ARC of Philadelphia and is a person with an intellectual disability and cerebral palsy. He's also a member of the Consumer Advisory Committee for the Institute on Disability at Temple University and has graduated from the Academy for Adult Learning program for people with intellectual disabilities. Please welcome Sean.
First of all, let me say good morning to all. Let me just take time out to thank Senator Casey, Mayor Kenny, my mom, family, and friends for being here today. And thank you for letting me be here to talk about this important issue that will affect our democracy. This issue that will affect people's life, and not just in Pennsylvania, but all people's life around America that have an intellectual disability. Many children in Pennsylvania depends on healthcare and Medicaid because to get the support that they need. Like me, I have cerebral palsy. Some other people have Down syndrome and autism and various disabilities. I was once one of the children. I received Medicaid in high school to help with my speech and my occupational therapy. Then I went to the AAL. When I graduated, and today it helped me to become the young, black, successful man I am today. And it helped pay for my supports. It helped me be more independent. The youth of today and tomorrow deserve the same opportunities that I have. Medicaid is a staple in our democracy. Medicaid is a staple in our country. If we cut Medicaid, we cut independence. If we cut Medicaid, we cut lifelines. If we cut Medicaid, we cut people liberties to be an American, to be a Pennsylvania, to be contributing part of society. Medicaid has really let me and my mom in to help us get the service that I need, and she can know that her child will be able to be successful. And that all because of Medicaid. So, to me, Medicaid is not just a program. Medicaid is not just a service, but what Medicaid really is, it's a staple in our country so that all people can be treated as equals, so that all people can so just let me tell the GOP before you cut Medicaid, think about you going to cut our democracy, you going to cut equality for those who have disabilities. We had came too far in the disability community to go back for where we came from. So, on that note, if you cut Medicaid, you cut a great nation. Thank you.
Lastly, I would like to introduce Talia Gottesman. She is a registered nurse at Hahnemann University Hospital. She is also the vice president of the local chapter of the Pennsylvania Association of Staff Nurses and Allied Professionals. Please welcome Talia.
Hi. Like she said, my name is Talia Gottesman, and I'm a nurse here at Hahnemann, just a couple blocks away. I'm also a member of PASNAP, which represents 8,000 nurses and healthcare professionals all over Pennsylvania. I'm here because I want everyone to know that cutting Medicaid and dismantling the ACA would have devastating consequences for our hospitals and for the patients that we care for. Medicaid provides health care coverage for many of our most vulnerable patients. It covers millions of children, people with disabilities, and senior citizens who need long-term nursing care. Philadelphia is the biggest city in America without a public hospital, which means we treat everyone together at hospitals like Hahnemann, Temple, and Einstein, no matter what type of insurance you have. Our patients rely on Medicaid for their care, and our hospitals rely on it to keep the doors open. At Hahnemann, where I work, 25% of every dollar the hospital receives comes from Medicaid. At St. Christopher's, our children's hospital, more than 60% of the care they provide is covered through Medicaid. Because they're a children's hospital and children make up the majority of all Medicaid enrollees. When Pat Toomey and Paul Ryan talk about cutting $800 billion from Medicaid, they're talking about stripping coverage and cutting services for these patients. They're attacking health care for kids and the elderly in order to hand more tax breaks to the wealthiest Americans. As an RN, I say that that is cruel. Their plans would starve our hospitals of critical funding. When they squeeze Medicaid, they're also squeezing the hospitals that we all rely on for everything from routine surgeries and childbirths to cancer care and car accidents. Our hospitals can't afford to absorb these losses without laying people off and sacrificing quality of care. And that will impact everyone, no matter how you have your insurance coverage. Medicaid works. It covers patients who desperately need health care so they can have ongoing access to doctors and nurses. I don't want to see us go back to a time when people delay their care due to lack of insurance and then show up in emergency rooms when it's too late for us to help. Easily treatable conditions like diabetes or high blood pressure can end in amputations or strokes, causing permanent damage. I don't know any nurse who wants to tell a patient, "You waited too long." I also want everyone to know that dismantling the ACA would eliminate important protections that benefit all of us, even the healthy. Nurses can tell horror stories about patients who came up against lifetime caps on their insurance while they were still in treatment or fighting to recover. A complicated form of cancer or a severe car accident could easily push someone up to their cap. The ACA ended these lifetime caps, and bankruptcies due to medical bills are finally on the decline. The ACA made preventative care free under most insurance plans, meaning that we no longer have to pay out of pocket for screenings. 1 in 2 Pennsylvanians have already gotten free screenings for things like osteoporosis, breast or cervical cancer, and HIV and STDs with no copays or cost sharing or deductibles. That saves lives and money out of our healthcare systems. The plans that Republicans are offering are dangerous. 22 million people will lose health care coverage. Millions more could lose important protection like free preventative care. It is not an exaggeration to say that people will die if the Republican plans are allowed to become law. When every major healthcare organization in the country is standing against your proposal, you know that it's bad. The American Heart Association said it's literally heartless. The American Academy of Pediatrics said it fails children. The Cystic Fibrosis Foundation said it's unacceptable. The American Medical Association and National Rural Health Associations are all against this. Nurses all over Pennsylvania are against it too, because we see up close every day how patients would suffer and how our hospitals would starve. The proposals being pushed by Pat Toomey and Paul Ryan are dangerous, and we have to stop them.
Thank you, Talia. 3 things very quickly before we close today. First of all, I'd like to thank the Executive Director of the ARC of Philadelphia, Tanya Regley, for this opportunity to speak before you today. Secondly, as Senator Casey was speaking, it reminded me of the old adage that we say in special education. Fair is not, fair is not that everybody gets the same thing. Fair is when everyone gets what they need. We need to advocate for what's fair for all of us. Can you bring him up here?
Thank you for coming.
Thanks for coming, everybody. Thank you. Can you wave to the people? Thank you.